Welcome to MicroMed Education, and today we'll discuss regarding sample collection and transportation, and I'm Dr. Rachana Solanki. Before proceeding to our sample collection and transportation, let's discuss brief regarding the various investigation done in microbiology. So either it can be a culture sensitivity, serological reactions or testing or molecular test. Remember students, for all culture and sensitivity testing, the specimen has to be collected into a sterile container. Ideally, the sample should be collected before introduction of antibiotic to the patient. And if your patient is already on any antibiotics, prefer to take the samples before its next dosage. CS is used mainly for the diagnosis of bacterial and fungal infection. Remember, the culture sensitivity is never used for the diagnosis of viral infections because the viruses are non-cultivable. They can only be cultivated in cell lines. Now, serological testing, the preferred specimen is serum. However, it can be done from various specimens. Let's have some few examples like galactomannan test can be done from the bile as well as from the serum. CSF can be used for the detection of the cryptococcal antigen detection. This serological test mainly used for the detection of either antigen or antibody. Two types of methods generally used are rapid, that is a lateral flow assay, that is which are generally called as, or latex agglutination test is a point of care assay, and another is ELISA. Serological test and molecular test can be used for the identification of all microorganisms, means for identification of bacterial infection, parasitic infection, fungal infection, viral infections, for all the infections. Molecular test, generally the test preferred is polymerase chain reactions. Now this is a picture of a sterile container. Which other samples has to be collected in this are various body fluids, pleural, peritoneal, CSF, ascitic, respiratory samples like sputum, ET, TT, bile, tissue, pus, urine as well as stool can be used. This is a sterile swab stick and used for the collection of a bacterial culture, used for a swab stick, like from where you can take the swab, like wound swab, throat swab, oropharyngeal, nasopharyngeal swab, ear swab, vaginal swab, cervical swab as well as rectal swab. Now the most important part, this is a plain container which is used for the collection of a blood, but the specimen would be after its coagulation is the serum sample, and the test prefer is antigen or antibody detection test. Now these are the automated blood culture bottles. Here also the sample is blood, but the investigation would be a blood culture. Generally mostly two types of bottles we recommend. The blue bottle, these are adult bottle in which around 8 to 10 ml of patient blood is used, and pink bottles are for pediatric. In this 1 to 3 ml blood per bottle is used for the pediatric patient and 0.5 to 1 ml for neonates. Now after showing this bottle, generally the next question would be what are the indications of the blood culture. So the condition in which the bacteria are present in the blood, like bacteremia, septicemia, pyemia, fungemia, pyrexia of unknown origin, and infective endocarditis. Then in the question frequently asked, which are the diseases associated with the bacteremia? The most frequent are enteric fever, brucella, and leptospirosis. Remember, whenever we take a blood culture, it is a pair. The one pair includes two bottles, one aerobic bottle and another anaerobic bottle. Now, whenever we take a blood culture, one pair, but ideally two sets are collected. That means 4 bottles. So whenever we'll take a one pair, the 2 bottles, one from the 2 different sites. Prefer 2 peripheral sites. If patient has already a central line present with them, then you have to take the blood from one from the central line and another from the peripheral line. Whenever you take 2 sets of the blood culture, remember to wait for half an hour between the 2 sets, so it will detect transient bacteremia as well. The collection or the preparation of the site is extremely important step for the collection of the blood culture. So after performing hand hygiene and putting the gloves, engorging vein, the most crucial step is the site, that you have to disinfect the site. Prefer with 3 steps, that is spirit, betadine spirit, or a spirit and chlorhexidine step. People generally perform this step from center to the periphery. However, they always forget to clean the bottle flap, the rubber stop of the bottle, that has to also be cleaned with the spirit and allow it to dry for 1 minute and then insert the blood. Remember, all the blood, the culture samples, whenever they are in delay, they have to be refrigerated at 2 to 8 degrees Celsius, except blood culture and CSF sample. They both has to be kept at room temperature. So we have discussed regarding the collection, the volume, and the number. Now another important culture we'll discuss here is the urine culture. Remember, a midstream, Follis catheter, or suprapubic. These are the 3 sites from where you can collect a urine. The most preferred one is midstream, in which you have to ask the patient to clean their genitalia with soap and water and remove the first portion of the urine and collect only the mid portion. Follis catheter is a different technique that we'll discuss. However, this Follis catheter and suprapubic collection methods are the invasive one. In the Follis catheter, whenever you collect the urine sample for culture, first clamp the catheter. We don't want a stagnant urine. We want a fresh urine that is collected from the bladder. So after clamping the catheter, you have to clean the exterior of the catheter with the disinfectant, clean the catheter port as mentioned in the figure, and then collect the urine sample that is freshly collected from the catheter port with the use of a needle and syringe. Thank you so much.